Today we have Mr. Burns on the table. He's been a patient for some time now. He's, how young are we, Mr. Burns?
72.
72 years young. If I could get all of my patients to be as agile as Mr. Burns is at 72, my life would be a lot easier when I'm helping patients. But what we're doing with Mr. Burns right now is doing a little flexion distraction, opening up his spine. As you can see, we've strapped him in here, strapped his legs in. You okay, Mr. Burns?
Yes, I am.
And then we're going to go ahead and press the button, and you're going to kind of see it almost like a whale tail. It's going to come up and down very slow at first. Of course, Mr. Burns has been on this table a few times, so he kind of has an understanding of what to feel. Is that too tight? Is that okay?
No, it's fine.
Okay, I can probably loosen that a little bit. Okay. And all this is doing is really opening up the joints or the vertebra in his lower spine, allowing the nerves down there to breathe. That's okay?
Yep. Yes.
Beautiful. Now we're gonna just relax the muscles and the tissue a bit. A lot of the muscles in the lower pelvic region here and in the lower lumbar region all connect down here through the pelvis and the hip on both sides of the knee, which is why we also get a lot of patients that have knee problems, sometimes as a primary or secondary result of imbalance in the lower back pelvis region. Fortunately, Mr. Burns is okay with that. But as I tell most patients, and I've told Mr. Burns on a number of occasions, he's 72 years young, and he remains extraordinarily active, and he's very active in his own keeping active, and stretching and keeping up increase of flexibility, which is sometimes one of the bigger battles that we have with many of our patients who just want to feel better, but sometimes not put in as much work for themselves. Would you agree, Mr. Burns?
Yes, I do.
All right. Typically, an adjustment will last anywhere from 3 to 15 minutes, depending on how much work we have to get done. But with Mr. Burns, he's been a patient of ours for some time now, so we can usually know what to expect and what to do with him. Now what we're doing here is I'm stabilizing my superior hand here upon his upper lumbar vertebra, and then laterally flexing his lower half of his body to help open up and break down some muscle spasms in that region, which is not always the most comfortable, but the benefits. And I often say with what we do here for a living, when you're getting adjusted, sometimes there's a bit of no pain, no gain mentality. Again, Mr. Burns, would you agree that sometimes?
Yes, I do.
So sometimes it's a little discomfort, but sometimes you have to create a little discomfort to open up and allow some of those vertebrae to move a little more freely and breathe. The nerves appreciate that, especially the old adage of "you're getting on my nerves." That's what the nerves are saying to themselves inside. Now we're going to shut this off. We're going to unlatch his chest region. We're going to stretch out his quadriceps a little bit. So we're going to put some little pressure upon the lateral side of his pelvis to again open up the musculature in there. And same thing on this side, relax. You'll feel a lot of tightness in his front of his legs, the quadriceps. the more flexible one can be and get, the more range of motion. The body loves motion. The more motion you get, the better off it's going to be. Okay. Now with Mr. Burns, we're going to do a little drop technique. You're going to see the bottom half of the table come up, and it's going to make some noise and then come down as I set the bones, or the pelvis and the hips and the lower lumbar into their right spots. So you're going to feel the table come up, and we're going to drop. Okay?
Yes.
Good. And then we're going to just motion the upper back. Arms to the floor for me, Mr. Burns. Breathe. Good. Good. Breathe in. Nice and easy. Okay. Mr. Burns, just get you to come and sit up here so I can get that upper back, if you don't mind. Okay. Let's kind of scoot your bottom back. Relax nice and easy. We're going to raise you up a little bit. And we're going to ask you to sit up straight and tall. Bring your arms back behind your head. Okay. Elbows together. I want you to resist, resist, good. Resist out, resist, good. Kind of let me in a little bit. We're going to open up this upper back, okay? And just let your body go a little bit. Breathe out, let it go. More, good. Perfect. Does that feel good?
Beautiful.
On your back. And we're just going to do a little subtle motion in his neck. Very gently, very easily. Again, Mr. Burns being 72 years young, it's a tribute to him to be into the relative good shape he is in, taking care of himself, because a lot of times adjustments I can do with him, I can't do on all 72-year young people. Let it fall. Good. Good stretch. More, let it fall. Good. Loose, loose, loose. And let it fall. Open your mouth, let it go. Good. A little stretch. Perfect. And that's Mr. Burns' adjustment. How'd that go?
Very well.
Come on up. Thank you very much, and thank you for watching. Today we just finished an adjustment with Mr. Burns, and Mr. Burns has been a chiropractic patient for how long?
Since 1967.
1967, and part of the purpose of me, and thanks to Mr. Burns in creating videos like this, is to simply educate the public. And Mr. Burns has a real brief story back in the 60s when he was introduced to chiropractic from a friend who prior to that was pushed towards getting cut on and needing surgeries and possibly some unnecessary medication. So if you wanted to share with that, Mr. Burns, your story?
Yes, in 1967 I was involved in a rear-end collision, and I was injured in the lower cervical area severely, and I was consulted by a physician who forwarded me to a surgeon, and a friend of mine said I wouldn't do that just yet if I were you, that I would consult a chiropractor. So I did that first, and the chiropractor said, I will tell you what I can do for you, and as much as I can do for you, and if I can't help you, I'll also tell you. I have never had back surgery, and I have continued to go to a chiropractor, and I hope I never have surgery. Thanks to chiropractors.
And thank you very much, Mr. Burns, with that, because hopefully with just a tidbit of that story can kind of enlighten somebody else to not stay necessarily away from surgery or medications, because certainly here at Bay West Health and Rehab there's a time and a place for that, but also in understanding that we do have alternatives. and that chiropractic, though may not be able to help everyone, can certainly help someone like yourself who's now 72 years old, still getting adjusted, and in relatively good health, even through what you've been through. And I want to thank you for your time, Mr. Burns, and I hope you have a wonderful, great day.
Thank you.